Hello and welcome to the Sharp Psych. As someone interested in mental health, I've seen firsthand the impact that obsessive-compulsive disorder, or OCD, can have on individuals and their families as well. This disorder is seen as complex and can often be misunderstood by many people. That is why, in this video, we'll go over a comprehensive overview of this condition, including its symptoms, causes, diagnosis, and assessment, and finally, some treatment options. So if you like our content, please don't forget to subscribe and click the bell icon so that you get notified of any new videos that could help you. Also, check out the links in the descriptions for my best recommendations. Now, let's get into it. If we want to define this condition for a better understanding, I will say that OCD is a condition characterized by repetitive behaviors or mental acts, which are compulsions, and unwanted thoughts or obsessions that are carried out in response to those thoughts. These compulsions can provide temporary relief from the anxiety caused by the obsessions, but they often become time-consuming and interfere with daily life. Unfortunately, this condition affects millions of people worldwide. That's why understanding its symptoms is crucial in identifying and treating this disorder. In this part, we'll talk about some common symptoms. So these obsessions can take many forms, such as fear of contamination, fear of harming oneself or others, or excessive doubt and indecisiveness. These thoughts can be distressing and often lead to compulsions, which are repetitive behaviors or mental acts that are performed to alleviate the anxiety caused by the obsessions. Compulsions can take many forms, such as repetitive hand washing, checking, counting, or arranging objects in a specific way. Also, people with OCD often feel compelled to perform these behaviors, even though they know they're irrational and excessive. The compulsions may provide temporary relief, but they can also interfere with daily functioning and cause significant distress and impairment in social, occupational, or other areas of life. In addition to obsessions and compulsions, people with OCD may also experience other symptoms, such as hoarding, skin picking, or body dysmorphic disorder, BDD. These symptoms can further exacerbate the distress and impairment caused by OCD. What people may not know is that OCD can take different forms and types. Each one has its own symptoms and characteristics. Although these types of OCD can overlap, some people may experience symptoms of more than one type. The first type of OCD that we're going to mention is contamination OCD, which is characterized by an excessive fear of germs, dirt, or contamination. People with this type of OCD may engage in compulsive behaviors, such as excessive hand washing, avoiding public places or objects, or wearing gloves and masks. Another type of OCD is checking OCD, which is characterized by an excessive fear of harm or danger. People with this type of OCD may engage in compulsive behaviors, such as repeatedly checking locks, appliances, or switches, or constantly seeking reassurance from others. Hoarding OCD is another type of OCD. It's characterized by the excessive accumulation of objects and possessions. People with this type of OCD may also have difficulty discarding or getting rid of items, even if they're no longer useful or valuable. Next, we have symmetry and ordering OCD. This one is characterized by the need for symmetry, balance, and order in one's environment. People with this type of OCD may engage in compulsive behaviors, such as arranging objects in a specific way and counting or repeating certain words or phrases. Finally, intrusive thoughts OCD is a type of OCD characterized by disturbing or intrusive thoughts that cause significant distress and anxiety. People with this type of OCD may engage in compulsive behaviors such as mental rituals or avoidance of certain triggers. After seeing the amount of suffering people with this condition experience, I'm sure many of you are wondering what causes this hell to break loose. Unfortunately, the exact causes of OCD are not fully understood, but it is believed to be a combination of both nature and nurture factors. Nature factors refer to the genetic and biological influences on OCD. Studies have shown that OCD tends to run in families, and there may be specific genes that increase the risk of developing the disorder. Brain imaging studies have also found differences in the brains of people with OCD, particularly in the areas related to anxiety and impulse control. Nurture factors refer to the environment and psychological influences on OCD. Traumatic events, such as abuse or neglect, may increase the risk of developing OCD. Additionally, certain personality traits, such as perfectionism or excessive responsibility, may also contribute to the development of OCD. Diagnosing OCD isn't easy, as symptoms can be similar to other mental health problems, and that's why a careful diagnosis is crucial for effective treatment. The diagnostic criteria for OCD includes the presence of obsessions and/or compulsions that are time-consuming and cause significant distress or impairment in daily functioning. These symptoms must also not be due to the effects of a substance or another medical condition. To assess for OCD, a mental health professional will typically conduct a thorough evaluation that includes a clinical interview and symptom assessment. The clinician may use standardized questionnaires or scales to assess the severity and frequency of symptoms, as well as the impact on daily functioning. In addition to the evaluation, the clinician may also conduct a physical exam and laboratory tests to rule out any underlying medical conditions contributing to the symptoms. It's important to note that OCD can present differently in different individuals, and the symptoms may vary in severity and frequency over time. Therefore, ongoing assessment and monitoring of symptoms are essential for effective treatment. There are several treatment options available for OCD, including medication and therapy. A combination of both may be most effective for some individuals. Selective serotonin reuptake inhibitors, or SSRIs, are a type of medication commonly used to treat OCD. They work by increasing the levels of serotonin in the brain, which can help to reduce anxiety and obsessive thoughts. Cognitive behavioral therapy, CBT, is a type of talk therapy that focuses on changing negative and irrational thought patterns and behaviors. CBT is effective in treating OCD by helping individuals to identify and challenge their obsessive thoughts and compulsive behaviors. Exposure and response prevention, ERP therapy, is a cognitive behavioral therapy technique that gradually exposes individuals to their obsessive thoughts while discouraging them from engaging in compulsive behaviors. Through repeated exposure, individuals can learn to cope with the anxiety triggered by their obsessions and reduce their reliance on compulsions for relief. In addition to SSRIs, other medications may be used to treat OCD, such as tricyclic antidepressants and antipsychotic medications. These medications can have side effects and may not be effective for everyone, so it is important to work closely with a healthcare provider to find the best treatment plan. In addition to medication and therapy, there are lifestyle changes and self-help strategies that can be effective in managing OCD symptoms. These may include regular exercise, stress management techniques, and mindfulness practices. It's also important to maintain a healthy sleep schedule and avoid substances that may exacerbate symptoms, such as caffeine and alcohol. Living with OCD can be challenging, but there are coping strategies and support systems that can be helpful. Building a support network of family, friends, and mental health professionals can provide a sense of community and understanding. It can also be helpful to engage in hobbies and activities that bring joy and fulfillment. In the last section of today's video, I would like to go over two conditions that people get confused about. Obsessive-compulsive disorder, OCD, and obsessive-compulsive personality disorder, OCPD, are two different mental health conditions that are often confused with each other due to their similar names. However, these are two distinct disorders. Before we go through the difference between the two conditions, make sure to check the links in the description for my best recommendations, and don't forget to like and subscribe and share this video with people who may need it. Also, we always look forward to hearing your thoughts and suggestions in the comment section. So, OCD is characterized by the presence of obsessions and/or compulsions that are time-consuming and cause significant distress or impairment in daily functioning. Obsessions are intrusive and unwanted thoughts or images that cause anxiety, while compulsions are repetitive behaviors or mental acts that are aimed at reducing anxiety. OCD is considered an anxiety disorder and is often associated with high levels of stress and impairment in daily functioning. In contrast, OCPD, obsessive-compulsive personality disorder, is a personality disorder marked by an enduring pattern of being fixated on orderliness, perfectionism, and control. Individuals with OCPD are typically rigid, unbending, and excessively focused on details. They may encounter challenges in delegating tasks to others and may face difficulties in decision-making or task completion owing to their perfectionism. Unlike OCD, OCPD is not linked to elevated anxiety levels, and individuals with this disorder may not experience substantial distress or impairment in their daily functioning. This means that while the two disorders may share some similarities, There are distinct conditions that require different treatment approaches. OCD is treated using the options we mentioned previously, while OCPD may benefit from therapy aimed at improving interpersonal skills and reducing perfectionism. In the end, I understand that obsessive-compulsive disorder can be a complex and often challenging condition, but with the right treatment and support, individuals with OCD can live fulfilling and productive lives. So if you or someone you know may be experiencing OCD symptoms, it's important to seek help from a mental health professional. Remember, you are not alone in this journey toward recovery. Thank you for watching, stay safe, and see you in the next video.